What's up, guys? Welcome back to From the Ground Up. Today, we are going to talk about something that actually came across my Instagram DMs from another pelvic floor PT. She sent me a question, and I thought her question was so great. I was like, you know what? I'm going to address that on the podcast because I think this is going to help a lot more people than just her and her patient. And it's probably a little bit of a shorter episode because I'm going to kind of go into a super specific topic. We are going to discuss, can a higher drop shoe be contributing to our patients leaking? And the short answer of that is absolutely yes, it can. And let's talk about why. So the pelvic floor cannot do its job automatically, which is, it's supposed to be able to be responsive and anticipatory and really work automatically to manage pressures and forces and loads and all of that without us having to think about it, especially when we are walking and running, right? And it cannot do that if the iliums, the bones of the pelvis itself, don't have internal rotation, okay? Because that internal rotation is what allows the pelvic floor muscles to spring back up and really manage the pressure. And the pelvis cannot achieve that internal rotation if the foot itself is blocked from pronating and loading at the midfoot. And that higher drop height in a shoe is actually going to limit that pronation and that ability to load into the midfoot. So to kind of like sum it up into one big sentence for you guys, the higher drop in a shoe is going to actually limit our ability to go into that midfoot load, that pronation load, which is going to limit the pelvis ability to go into internal rotation. And if the pelvis can't go into that internal rotation, then the pelvic floor muscles can't do their job to kind of reascend automatically and responsively to the forces and the pressures to support the pelvic organs and to keep PN. Okay. So let's get into it a little bit more. What actually is shoe drop and why should we care? So shoe drop is simply defined as that height difference between the heel and the toe of the shoe. And this is not the outside heel and toe. This is, where your foot sits inside. So think of like an extreme example is like a high-heeled shoe, like a pump, right? You can imagine your foot being in there. Your heel is literally way up here in the shoe compared to like your forefoot and your toes, right? So a high-heeled pump is an extreme example of a shoe with a large drop. Okay, that it's a large differential between the height of where the heel is sitting in the shoe and the forefoot is sitting in the shoe. Okay, now the other extreme is a flip-flop, right? Think of the flat flip-flops like from Old Navy that used to be like $3 back in my day, at least. They're just literally a piece of rubber or plastic or whatever they're made of. And there's no, contouring. There's no heel. There's nothing. That is zero drop. That is zero height difference from where your heel sits on the shoe to where your toe and your forefoot sit on the shoe. Okay. So a higher drop equals heel is elevated relative to the forefoot. And a lower drop is we're working our way back down to an equal level playing field of where the heel is sitting relative to the forefoot. Okay. We have to know how to treat the pelvic floor from the ground up, you guys. And that includes what is sitting between the foot and the ground, AKA our shoe. So if we're treating the pelvic floor from the ground up and we have a shoe that is at play there, we have to kind of understand what possibility that shoe is. We have to kind of understand the possibility that that shoe is altering our biomechanics, gait pattern, how we're sensing the ground, and all of that stuff. Okay. And that brings me to, if it's impacting from the ground up, if the shoe is going to impact it, it's impacting the kinetic chain. It's impacting the kinetic chain's ability to do its job and kind of go in and out of internal and external rotation as we walk, run, jump, twist, all of the things. So what is the kinetic chain supposed to be doing, right? So when the midfoot goes into that pronation, assuming it can, when the midfoot loads into that pronation, we kind of set off this cascade of internal rotation above it. So we get midfoot loads into pronation. That will kind of be paired with calcaneal eversion as that subtalar joint moves into internal rotation and pronation. That ankle goes into dorsiflexion. The tibia is going to move into that internal rotation. Then we get femur moving into internal rotation. Then above that, we get up to the hip and the pelvis, and we get pelvic bone going into that internal rotation. That's widening the pelvic outlet. If you imagine the ilium's rotating internally, the pelvic outlet is going to open and widen. And that is when the pelvic floor can reascend to push pressure back up and to keep pee in. Think of it, this is that trampoline springing back up after it was kind of like loaded, okay? The pelvic floor needs to be able to lengthen when it's loaded to do this, to function automatically like we're trying to restore, okay? So that kinetic chain is really what gets altered whenever we change the footwear, especially when it comes to, we're talking about the drop height, but it also will be altered with like arch support and cushion. And is it an open-toed or a closed-toed shoe? Is it a flip-flop? Is there a heel on this? So like all these things in the shoe will alter this kinetic chain. Specifically, we're honing in on drop height here for you today to kind of explain what's happening, but just understanding that kinetic chain and kind of that IR, that internal rotation cascade that needs to be happening is really, really important, because that ilium, ultimately, we're trying to get that ilium the ability to internally rotate so the outlet can widen and pelvic floor can go boing and spring back up, okay? It has to be able to lengthen when loaded to function. This is gait, this is running, this is standing on one leg, this is life, you guys. Like, this has to be happening with every single step we take, every twist, every cut, every turn, every time we land on a leg when we're running. All of that kinetic chain has to be able to go into that cascade of internal rotation for the pelvic floor to spring back up. So what does a higher drop shoe actually do to all that? When that heel is elevated relative to the forefoot, that is putting the foot in relative plantar flexion. Okay. And if you remember, part of that IR cascade is dorsiflexion. So we're kind of removing that. And because we go into that relative plantar flexion and we have less dorsiflexion, that's why we're loading the midfoot less. We're getting less pronation simply because of that angle that higher drop has put the foot. Okay. So it reduces that full midfoot pronation excursion. Okay. We have limited dorsiflexion, which is then that cascade up above it is going to decrease tibial IR, decrease femoral IR. Pelvis will remain more externally rotated, so it's going to get less IR. That means the pelvic outlet is going to stay smaller. It's not going to get fully widened. And that means the pelvic floor is going to remain more shortened, and it's not going to get that nice eccentric kind of shooting back up. It's going to remain a little bit more descended, okay? A pelvic floor that cannot lengthen under load cannot manage pressure. This is the trampoline effect. If when you land on a trampoline, you never, went on, like the trampoline never stretched underneath your weight, then how it's never going to spring back up and manage the pressure of you, if that makes sense. So like, this is why the pelvic floor has to be able to lengthen under that load to kind of absorb the force. And it can only do that with ilium internal rotation. That's why this IR cascade matters. Okay. That's why drop height on a shoe matters. And it matters clinically because I want you guys assessing footwear. I want you guys assessing midfoot mobility. I want you assessing dorsiflexion, range of motion. Do they have the range of motion? Can they control the range of motion? Are we looking at tibial rotation whenever they're walking, running, squatting, lunging, all of that stuff? If you never assess the foot, you might be missing the main driver of your patient's leaking, especially if it's a runner who is leaking when she runs and she wears kind of a more traditional running shoe that has a higher drop. Now, higher drop, I like to think of drop heights as a lot of traditional running shoes usually are around like 10 millimeters of drop height, meaning where your heel is, it's about 10 millimeters higher than your forefoot and toes. So that's, to me, is considered a high drop height. I want my patients working down to zero drop. So same height differential between heel and forefoot and toes. But, anything really like 4 millimeters and under, I consider low drop and really is going to have, very minimal, if any, impacts on that kinetic chain. But ideally, we are working them down to the ground. We are getting them to be able to tolerate the load at the plantar fascia, at the Achilles, at the calf muscles, all of that stuff. When we're putting them in more dorsiflexion, their foot and ankle has to be able to lengthen into that load, right? So, we have to sometimes help our patients work down into these lower drop shoes, and that's fine. I really like Ultra running. They have a lot of 4mm and 0 drop options, and of course, all of their shoes are wide toe box. They have varying levels of cushion and all of that. So their shoes are really, really great, especially for helping my patients who are used to a more traditional running shoe with a higher drop, a little more rigidity to it, and narrow toe box. I like to work them down. We'll start with one of their 4mm shoes, and you can see all of that on their website. Knowing kind of which shoe to recommend. But in general, we need to be assessing our patients' footwear no matter what, but especially in our patients who are leaking or having pain or pressure symptoms when they are moving, when they're walking, running, jumping, landing, loading, all of that stuff. We have to be looking at things from the ground up, and that includes what is between the ground and their foot, you guys. This is not about demonizing shoes. I don't tell my patients they can't wear high heels. Please do what you will with your shoes, but I do want you guys to understand these concepts because the pelvic floor does not live in isolation, and it's greatly impacted by these mechanical changes that happen with shoes. Okay. And so it's if that is the root driver, we need to be catching it so that way we can help our patients overcome their symptoms for good and not just keep giving things like Kegel stretches, hip mobility, because if the problem's coming from the ground up, you're going to do all this stuff up at the pelvis, even if it's good stuff, even if you're improving internal rotation at the pelvis, they're going to get up and walk away. And if the problem is coming from the foot or from the shoe, from the ground up, none of it's going to matter anyways, right? Because if you block pronation, you block internal rotation. And if you block internal rotation, you block pelvic floor's ability to lengthen. And if you block that lengthening, you're blocking that function because that length is that trampoline absorbing load and being able to push it back up. Okay, that's why we need pelvic floor to lengthen eccentrically under load. All right. So like I promised, this was a short one. Hopefully it was a deep dive into footwear and gets you thinking a little bit and thinking about some patients that might be on your mind that are runners. Maybe they're leaking as well. And hopefully you're going to look at their shoes and their foot next time. So if this was helpful, please share this with a colleague, share it with another PT, OT, coach, movement professional, all of that. That is truly how we change the game of pelvic health, is by sharing what we learn, right? And being better together. So please share. I also always love it when you guys share to your stories and tag me. I love to see that you're listening to the show. I love to see that you're enjoying it. And honestly, your biggest takeaways, tell me, send me a DM, put it in your story when you share, all of that. But let me know what you thought about this episode. I hope everyone has a great rest of your day, and everyone go look at your shoes and your patient shoes and make sure it is a low or 0 drop. Let's change the game, y'all.